So Sheramin, I understand that you're interested in having some dermal filler treatments.
Yeah.
Do you have any questions or concerns that you want to ask me about having a dermal filler treatment?
So my big question is, what exactly is dermal filler?
Okay, so dermal filler is a hyaluronic acid. Hyaluronic acid is something that we have naturally within us, in our support structures, within our skin. But this is not human derived, it actually comes from a plant and then it's stabilised. And then it's pre-packaged in a syringe in the form of a gel. And basically what happens is that when we inject the hyaluronic acid into the skin or below the skin or wherever it is that we need to place it, your body responds by making lots of collagen around it in a way to kind of isolate it. And that encapsulates it and forms an implant. So it's an injectable implant that we're putting into your face.
Okay. So how long will it last?
It's different for different areas of the face. So areas where you move a lot, it will break down quicker because your muscles and your activities challenge the integrity of the filler more. And then in other areas of the face, you'll find where there's less activity, the filler will last much longer. So generally speaking, on actually all of the, within a range, you have different levels within the filler range. So different fillers appropriate for different needs. And they have different qualities in terms of thicknesses and how much hyaluronic acid there is in there per mil and also molecular size, and these affect the durability, the strength, the lifting capacity, and also how long it lasts. So all of these things affect how long a filler lasts in your face depending on where we put it. They all say 6 to 12 months, but actually what we're finding is that for example under your eyes, anything up to 2.5 years, you might find that, yes, it's gone down a bit perhaps at 6 months, especially in the early stages when you're having your first treatment, because it's something very new to your body, then it will go down just that little bit quicker. But every time you maintain, then it will last longer, because every time you maintain, you get more collagen, which stays with you, and your body gets used to it, so you'll find your body will hold on to it for longer, and eventually, quite quickly, you'll go into a maintenance mode, but find that your maintenance treatments become further and further apart.
So when will I realistically need a maintenance treatment after I have this treatment now?
Okay, so your first maintenance treatment could be anywhere between 6 and 12 months. So expect your filler to have gone down a bit, but not gone completely.
Okay.
And the idea is basically to maintain your look, then you need to do a maintenance treatment when it has just gone down a bit, instead of waiting for it to go back to, completely back to zero. Otherwise, what you're doing then is really starting all over again. And not getting the actual correction, because every time you maintain and put filler on top of a previous treatment, existing filler already in the face, you actually get more of a correction, so you get further enhancement on top of what you've already achieved, and we want you to get into that mode.
Okay.
Yeah.
And are there any side effects?
There are some side effects associated with dermal filler treatments. You have you can be allergic to dermal filler. You can be, worst case scenario, you can have an anaphylaxis, which is an allergic reaction, but it's a life-threatening type of allergic reaction. It's very important that you know that. And you can also have problems with blood flow and vascularity that then lead to other issues. So, that doesn't just happen on its own, it happens for very specific reasons. So, if too much filler is applied, if it's not applied in a way that takes your anatomy into consideration, and by anatomy I'm talking about, where your where your blood vessels lie, and also even where nerves lie. We can actually make it uncomfortable for you if we compress the nerve, and also if we obstruct good blood flow or inject directly into a vein, we can create something called necrosis. Necrosis is when your blood supply to a given area of skin tissue isn't received, and so what happens is that skin tissue will die, and it happens very quickly. And there are signs that appear actually immediately that would lead to that happening, so it can be picked up earlier on. So it's very important to really sort of minimise the risk to that actually happening in the first place, really, instead of just sort of arriving at that point and then firefighting and trying to put it right. So I have limitations on how much filler I would do in one session, okay, so that we can treat you respectfully, be respectful to your tissue and to your facial structures. And also as well, I use different methods of delivery to make the treatment safer. So for example, around your eyes, I don't use needles to do the treatment. I actually use cannulas. And a cannula is a long, thin, reed type instrument. It's blunt, so it can't shear through structures. It can't go into a vessel, because I select a size of cannula that makes that harder to happen, because it's much thicker, because you have different widths of cannulas. Okay, so I work with a size that makes it much more difficult for that to actually happen. And that way I can, minimise the risk of actually injecting directly into a vein. And so that, coupled with, having a limitation on how much filler I do in a session, significantly minimises the risk for harm. Unfortunately, I can't guarantee that you will not have a problem with a filler treatment, because these same problems that I just talked about can also lead to blindness. So there is a risk for blindness. There are 36 cases globally that have been reported where people have had blindness, and that's all different types of blindness. So blindness in both eyes, blindness in one eye, blind spot, where they have sight but then there's an area they can't see. And this has come about through filling type treatment. So not just hyaluronic acid, but filling with fat as well to the face. In fact, majority of them have come through from fat injections, and the reason why we think that is to do with the force of the product, the substance rather, coming through into the face, and also the type of instrument that they use to do it heightens the risk as well for that damage to happen. However, there are cases that have derived from filler treatments, and they tend to be, for the most part, associated with specific areas. So temples, glabellar filling, which is this area between your eyebrows, are very high risk areas, and one of the other very high risk areas is actually around the mouth, because it's a highly vascular area, so it's easier to inject into a vein. So unfortunately that risk will always exist, and I can't say it's never going to happen. But what I can do is just try to do my best to make the treatment as safe as I can, with all of that in mind.
Okay. Is it painful?
It's, some treatments are more, I wouldn't really say painful, but sensitive than others. So you have like a discomfort factor, and it shouldn't be painful, because I have to say, true pain, that would worry me. So it's not really something I associate generally with these treatments. It tends to be that it feels uncomfortable, and then once you get the product going in, it has some pain relief in it. Actually, that numbs the area and then makes it much more comfortable for the subsequent injections that come after that. With the eye area, the first part is always quite uncomfortable, just sort of entering and positioning myself. And then after that, once you get that bit of product through, it really makes a huge difference. And most people, nearly all, say that it's not painful. There's just a sort of like an irritation factor, and it feels a bit strange at the beginning. I do have a couple of people that, with all the pain relief in the world, they might say, actually, it was just really, really, really uncomfortable. But never anything beyond that.
How long does it take?
Not long. I mean, today we'll be doing multiple treatments, so it will take longer than if I was doing one treatment on its own. So for your eyes, it will probably take about 20 to 25 minutes to do both eyes, and then working on your lower face, probably about 15 minutes to do. So that combined all together, and then to actually do the treatment. But you'll probably, what makes it longer really is you sort of waiting for your topical anaesthetic to take effect, because before you have the treatment I would put topical, so it's a cream, anaesthetic on your face and let that numb the skin, and that that helps greatly.
Okay.